When you've added a new patient and you want to assess them, these are your red cards, the first of the 3 series of questions. So you'd start with, have you been told you stop breathing during sleep? And the patient answers, no. Do you have high blood pressure or a heart condition? No. Is your neck size greater than 16 inches for women, 17 inches for men? This is an indicator of obesity. Do you have type 2 diabetes? No. Do you have epilepsy that's not well controlled by prescription drugs? This is particularly relevant for patients that you might think otherwise to refer to a dentist for the review of a mandibular advancement device. This is a red card for a mandibular advancement device. And then we're on to the second set of questions. And you'd ask the patient, have you noticed or has your sleep partner witnessed episodes of gasping or choking during your sleep? No or yes. Has your partner witnessed you stop breathing in your sleep? These are the witnessed apneas. Do you wake up hearing the end of your own snore? Do you have to sleep sitting up? Do you wake up frequently to use the bathroom? This is natriuresis. This is a sign, another symptom of obstructive sleep apnea. Do you smoke? Do you drink alcohol in the evening? And these are the things that, as a pharmacist, you can do lifestyle interventions to actually improve both snoring and patients that you might be managing with the sleep unit that have sleep apnea. Working on reducing smoking, evening alcohol, and obesity, managing their type 2 diabetes, these things will have a direct impact on whether they snore or how much they snore and the severity of their sleep apnea. Do you snore when sleeping on your back? Well, most people will do that, but it's an indicator in itself that do you snore in all sleep positions? You put these two together and you can get to the point, well, no, I don't snore when I'm on my back, when I'm on my side. Great. Well, let's get you off your back, or shall we say, I snore less when I'm on my side. Certainly, positional therapy then is suggested. Do you use sedative medication? Or it could be that they're polypharmacy, such that it makes them altogether have a sedative effect. You could review. Height and weight. These are to do with calculating a BMI. And we're on to the third of the series of questions. This is a pictorial version of the Epworth Sleepiness Scale. This question is, are you sleepy? Are you drowsy? What we're looking for here is not just tiredness or fatigue, we're looking for sleepiness. This is the propensity to actually fall asleep. So you'd ask the patient to imagine yourself in the situations below. Select the most appropriate image for how sleepy you would be, not just tired. A, and this symbol here, no chance of falling asleep. B, there's a slight chance. C, a moderate chance. D, highly likely. So let's just, now some of these situations might sound odd. So you ask the patient to have a think before answering. Remember that you're deciding how sleepy you'd be rather than how tired you might be feeling, which is different. And if you can't associate with the circumstance because you don't do it, well then this is where for the face-to-face assessment as a pharmacist, you can try to get them to encourage them to imagine what it would be like. So sitting and reading, most people know what it is to sit and read a book. Their likelihood to fall asleep. A, no, not sleepy. D, yes, highly likely I'd fall asleep. Watching TV, sitting inactive in a public place, a theatre or a meeting. As a passenger in a car for an hour without a break. Lying down to rest in the afternoon when circumstances permit, without alcohol. Sitting and talking to someone. Sitting quietly after lunch without alcohol. In a car while stopped for a few minutes in traffic. Now, this one's quite a question, and you need to look at the answers, not just add up the overall. You actually need to look at the individual questions and the responses, because let's just say they're over here for all of them, but they drive for a living. So no, they would never be sleepy when driving. an intelligent interpretation is required. So to get the referral on to a dentist, I want to show you what that looks like. Right, so your answers suggest a sleep-trained dentist would be most appropriate. This is also your opportunity for lifestyle advice, and we have a selection of dentists that you can refer to. So let's just go back and change your answers so that, yes, we're terribly sleepy. And what you'd get then would be referral to a GP. And this is the opportunity, again, for lifestyle intervention while writing, ideally, to the summary care record. And in writing, referring this patient to their GP. You have screened them. You've identified that they require further investigation. Move the patient on and help them. Lifestyle interventions will also help, but that's as an adjunct to a referral to their GP for further investigation, as in a sleep study.